Thank you all very much for being here this morning. I've made a number of announcements today relating to rural doctors, particularly looking at getting the right doctors with the right skills to the right places. The government has made some changes to the ASGCRA system. Quite simply, that's an existing program that provides incentives to doctors to move to rural areas. Now, the current system has huge anomalies where we're seeing the same incentive payment going to doctors to go to a large regional town at the same amount as doctors going to a small rural town. So the changes I've announced today, moving that to what's called the modified Monash model, means that there's going to be much better targeting of getting incentive payments to doctors to go to those areas of need, those smaller towns where we really need them to go. We've also made some announcements around changes to the District of Workforce Shortage System, which will be using updated statistics, so that will perform better. And we've also made some announcements around the bonded medical placement program, extending the criteria for those doctors to be able to go to towns of less than 15,000, as well as the DWS requirement that currently exists.
From the perspective of the rural doctors in the Australian College of Rural Remote Medicine, I warmly welcome this announcement. The unequivocal support of the Minister for changes that will see development, I think, of a pipeline for doctors into skilled rural practice. As the Minister says, right doctor, right place, right skills, and also right work. The opportunity to work in rural generalist medicine, the opportunity to have our junior graduates and young colleagues seeing a pathway of training ahead of them to broad skill set rural practice, able to serve the needs of communities in the clinic, in the hospital, in the home, and in emergencies. These are the doctors that the bush needs, has always needed, and will continue to need into the future. I believe these are a package of announcements that will go a considerable way to encouraging and supporting that style of practice and that style of training.